here that, boy, I'm Dr. Dan Erickson and Dr. Artin Masehi. I hope I'm saying that right, Dr. Martin. Artin, I should say. They're the co-owners of the Accelerated Urgent Care. They have 8 different locations throughout Central California. Their clinics offer private walk-in COVID-19 tests. I understand they've done more tests than anybody in Central California. They did a press conference and went viral because they questioned statistics that are part of the status quo that in this call you've seen over and over again, from Nobel laureates to epidemiologists to top MDs from Stanford, that they're right. They got a lot of applause, and then they were shut down by YouTube because they didn't match the World Health Organization, which, by the way, we've now proven has been shown that they were not accurate, number one, by any stretch, and may have actually been deceiving the country or the world based on what they knew in China. So I'd like to first welcome you both and thank you. And I'm so sorry what you've gone through, but I'm so grateful for your courage and what you've done to try to help educate people. Welcome to the podcast.
Thank you for having us, Tony. Yeah. Appreciate it.
Yeah, really do. Tell us what made you, you took a big risk. You've taken a lot of flack from people that are, living in the old narrative still, that they've not updated the facts. And it's almost like I watched the media interview you afterwards and they were hostile towards you. And I couldn't understand why would they want to know new facts, but it's just like they couldn't get it in their head because they've heard it over and over again. Tell us first, what made you decide to come forward and do this press conference? Because it was a big risk for you guys. You didn't need to do this. You're living your lives. You're on the front lines. You know what's going on. You're dealing with real patients. I heard you even mention when one person was saying, well, Dr. Fauci said this, and you were kind, but you said, Dr. Fauci hasn't seen a patient in 25 years, and we're here every day, doing the tests and seeing real people. So tell us a little bit, what made you come forward and take that risk, and what's been the response?
Well, we called the press conference after about 2 months. We had heard the original orders, the edict to, put on PPE, to test patients, and we towed that line for 2 months. And after doing 5,213 tests, we had about 340 positives. We saw about 6.5% of our data, our raw data, that was not randomized, was positive. And the media had been calling me and asking me, could you share data with us? We're hearing this stuff, from all over the world, but what's happening locally? So I said, well, why don't we just do a local press conference and I'll just run over the raw numbers and give my opinion on what's going on, give kind of a boots on the ground approach to this. And so that's what we did. I thought this was going to be a 2-minute news segment on a local station. Then they said, no, we're doing live Facebook. And I said, okay, I don't really do, social media that much and had no idea it was going to turn into this. So this was just our opinion on raw data. And I think it kind of resonated with people because we aren't using statistical models, sort of academic models. We're using raw numbers. We have a community of about 900,000, and we were seeing, the hospitals, their census was low. Last week, they had 14 patients with COVID in there out of hundreds of beds, and we had seen 3 ventilators. And we said, well, now wait a second here. We're seeing, 6.5% of our patients coming through. The hospitals are laying off doctors, laying off nurses, closing floors. What's really going on here? So I started looking at, Sweden. I started looking at South Korea and saying, maybe there's a different approach that we could look at. And I started seeing, hey, their kids under 16 are in school. Their businesses aren't open. So I started looking at their death rate. And I thought, okay, 260 per million. In the UK was 360. And I said, countries that are in complete martial lockdown are not having any better results. And so I started interviewing Dr. Witkowski, who is a biostatistician. He said, you're not going to stop this virus. You can shelter in your house if you want. You can stay home. It will move. People are social creatures. They visit each other. They go see their pastor. They go to the doctor. This virus is going to move whether you shelter in place or not. And they said, Dr. Witkowski, is sheltering in your place and wearing a face mask going to work? And he said, yes, it will keep the sky from falling.
Wow. This is so radically different than what we've been taught for 2 months, every day, 24 hours a day by the media and quite frankly, even by Dr. Fauci. But again, some people brought this up. They go, well, why should I listen to these guys? And I said, well, because Dr. Fauci is a good man, but he's wrong by 20 times. Not 5% or 10% or 15 or 20. And these decisions were made on, the best facts he had at the time. And he's come out since then and said, the models were wrong and he doesn't believe in the models, but he made the decision based on looking at China. And of course, China didn't give us real numbers either. I'm confused. We keep hearing so many governors saying we're making, including in California. Governor Newsom's a friend of mine. He's been in my Date with Destiny program. I have a great fondness for him. But, as we mentioned earlier, one death in Orange County, California, and of COVID-19 the entire time, he shut down the beaches and got really angry about it. And the data doesn't seem to show it. Like, how come I can go to Costco around hundreds of people, but I can't go to church? Exactly. How come I can drink alcohol, but I can't go for a run? Just help me understand where we keep hearing it's science, 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 but who is telling these numbers to the governors and that are around here that are making make these decisions? Because I know they care. I know him personally. He cares deeply about Californians. So why are they continuing to make decisions when the data is so radically different today? Is it just it's stuck in their mind, or we committed to something?
Have to pivot. The discussion has to pivot now. We towed the line for 2 months. We took a safe approach. We locked in our houses. My family was wearing N95s. I said, stay home. The kids came home. They're on Zoom right now. We towed the line. And then after I looked at the data, I read globally. I listened to Dr. Gisecki, Dr. Anders Tegnell of Sweden. I interviewed Dr. Vitowski. I had 2 Zoom interviews with him. So I did some extensive reading and said, you know what? What we initially did, I think, was appropriate. We looked at the Spanish flu. We saw 50 million deaths in 1918. We thought, well, we don't want that to happen, so let's control the spread. Let's flatten the curve. And I said, Dr. Witowski, what do you think of flattening the curve? And he said, it lengthens the disease cycle. Why would you want to do that? So that you can have a secondary spike later on? We get secondary spikes from the flu every year, where it'll spike in December, then we'll see it spike in January. This is a normal phenomenon of the virus. And just to be clear about vaccines take us closer to herd immunity. They're not some magic thing. They take us to herd immunity quicker than we would have without it. That's the whole point. And so when you flatten the curve, you take this longer cycle, longer time to develop herd immunity. And the biostatisticians I'm talking to said that only makes sense if the hospitals are overwhelmed, which I've talked to all 3 CEOs in my area. Their census is low. Our ICUs are open. We have surge capacity. We're ready. So I think the discussion now has to pivot to how do we open up the economy? And I listened to the interviews by Dr. Gisecki, and he said the United States has climbed this ladder now. Now you got to come back down. How do you do that? He said, open up all schools immediately. All kids under 16 do very well with this disease. Open up the schools. Watch it for 2 weeks. Watch the prevalence. Watch the incidence. Watch the death rate. And make dynamic decisions. But now what we're seeing is the collateral damage of COVID is way outweighing the disease itself. I can tell you about suicide cases personally, 23-year-old. I can tell you about anxiety, depression, alcoholism, all in my community that are skyrocketing now because of COVID. So I think the conversation has to switch now to how do we get the economy going again, because the collateral damage of the economy shutdown is becoming far worse than the virus itself.
Well, it's mind-boggling. I'd like to ask you, Dr. Masihi, am I pronouncing your name properly? I apologize.
Yeah, Masihi. Yeah.
Masihi. Dr. Masihi, tell me, you're seeing the same thing. I watched you as well, and you were both talking about these statistics showing that there's no reality to what we've been promoted, that the numbers just don't match. What made you decide to step up? And then tell me, if you would, what kind of reaction have you guys gotten, and what was the explanation that they gave you from YouTube, or why they took your simple discussion, you're just discussing facts, off of YouTube worldwide?
Well, as physicians and scientists, we took a Hippocratic oath to do no harm and to tell the truth. And we looked at our numbers, and we had some of Stanford's preliminary data was out. We're looking at these different studies, and we're saying, well, the epidemiology of this disease is similar to flu. And have we ever shut down for flu before? We haven't. Does it make sense to shut down the economy, to have folks, not have work, not be able to support their families? They can't feed their children. And we're both bleeding hearts in that way. And so we said we have to do something. And that's why we came out. And unfortunately, we've been received by the medical community and by some folks in the media, actually most of the media, as well, these guys are just pushing their agenda for their urgent cares or this and that, which is really sad, because I think most of us on this panel are we're all doing well, but it's the average American that is not doing well. And those are the people we need to be careful. We need to make sure we protect them because we are in a position where we can. We are their voice. So that's why we came out and discussed our results.
I'm really, my feelings don't matter, but I feel so sorry for both of you being so courageous, coming out and taking so much flack for just sharing real facts. It just shows that when people get fearful, I mean, I don't think anybody means bad by this. They get locked in their head. They make everything survival and they overreact. I mean, the amount of people that are angry at people starting to open some of these states are like, they're rabid, and yet they have no facts whatsoever, but they have the facts they were told in the beginning and they've locked that in their mind. And I mean, isn't science really continually updating the facts and making new decisions? That's my first question for either one of you. And my second question is, again, I think you spoke about this. The immune system needs stimulation to work. When I was a child and kids had measles, oftentimes a mom would invite everybody over when everybody got it at once, and then you built immunity to it. That's herd immunity. That's what we've done for history. We've never in the history of the world took healthy people and isolated them and stuck them home where 2/3 of the planet was shut down. So what is the difference here between how we normally think about science and what's happening? And is it true that our immune systems need stimulation to stay strong? Is isolation making us stronger in our immunity or weaker?
Well, I think it's fear. I think you hit the nail right on the head. I think it's fear. I think we're making decisions based out of fear. Initially, when this virus was we heard about this virus, we thought the fatality rate was 10%. And so the administration appropriately shut down the economy. I completely agree with everything they did and appreciate that they cared about the American people to do that. But after a couple of months, you kind of have to look at the data and say, what is the data saying? The Stanford studies, the New York data, University of Pittsburgh Medical Center,
and USC also in LA.
USC, that's right.
And they're all finding 0.1 to 0.12, 0.2, which is the same as influenza, the flu, correct?
All in the same ballpark as influenza. And one thing, and I know a couple of the doctors here on this panel, which I'm very appreciative that you invited us. I'm honored to be on this panel with these world-renowned physicians and scientists. The influenza is a very dangerous disease. I've had folks in their 30s and 40s die from influenza when I used to work in the ER, so was Dr. Erickson. Influenza is very serious, but we are familiar with influenza, so we say it's just the flu. So whenever you have something that you're unfamiliar with, you have lots of fear, and then trying to change people's narrative, their mindset with new data is very, very difficult because they have that old mindset, in place. And as human beings, we do need to interact with our community and our society. Obviously, we are, for two reasons. Our immunity goes down when we don't interact. We don't touch other people or touch different substances, and our objects and our bacterial and our viral flora actually go down in concentration, and these are actually good bugs that protect us from opportunistic infections. That's definitely one point. And the second is lots and lots of fear decreases the immune system. Anxiety, depression lowers the immune system, and the neuronal immune system has been well studied. And if you are scared and you are depressed, then you're more likely to get sick. So so that's
one point I'd like to make, Tony, if I may, is that having a disease process. Dr. Masihi and myself deal with COVID every day. We want the best care for these patients, but on a second note, when you start losing your constitutional rights to speak, in other words, we all should have the right to have a discussion on our opinions. There is different facts and different opinions, and as soon as you start saying, "Hey, I don't like your opinion, censor that guy," now we have a bit of a problem, because we all should be free. We've spent our lives studying this. I didn't study this for 10 minutes. This has been 20 years. So we've all spent our lives studying this. And I think the key point is, and what Americans want to hear is, if you're under 70, 99% of people, and you're never going to hear this on the networks, 99% of people will get through this and be healthy. So why are we taking their constitutional rights? Why are we telling them you can't go to the park? Where is the science behind can't go to the park? Where is the science behind can't go to the beach, but I can go to Costco and Home Depot? And I even went to the bike store for 2 hours yesterday and talked to a salesman, and he was 2 feet from me with no mask. That's okay. But if I go to church, that's a big no-no. So we see constitutional rights getting stepped on. I don't think a pandemic should ever take measures to reduce your constitutional rights while you're treating the ill.
It makes so much sense. What was the, either one of you, Dr. Arden or Erickson, what was YouTube's description of why they took you off? Because I saw you guys, I was blown away by, first of all, you guys were not political, which is I so appreciate it. I'm an independent. I voted for Republicans and Democrats. I don't have an agenda. I think that's where most Americans are. And you have no political agenda. You were just bringing the facts, asking the questions. And when I tried to send your videos to several of my friends, they came back and said, there's nothing here. I'm like, what are you talking about? And it said something about not following the WHO's guidelines. What was the reason that YouTube gave you for taking you off the air?
They didn't give us a reason. They said we violated their community standards or community guidelines, and that's exactly what our medical societies essentially said, that we were reckless, and I think they said we were in this for monetary gain or some.
Yeah, I saw reporters say you guys just want to fill up your emergency care centers or something.
Yeah.
It's like it made no sense whatsoever.
Yeah, it makes no sense.
It's interesting how our president defunded the World Health Organization due to their interactions, and yet YouTube is siding with the WHO. I find that interesting.
Yeah, I thought the same thing. It's pretty obvious that they did not tell us the whole truth, but we're using them as a standard. Pretty wild. Well, thank you for your service to this country, and hopefully this podcast won't get taken off YouTube too quickly. If it is, we'll put it everywhere else and get it out there. But let's now, we've talked to everybody individually, and you guys have been so wonderful with your time. We've gone over. But I'd like to come to Dr. Michael Levitt. Yes?
I just wanted to say that